So HAE stands for hemorrhoidal artery embolization. And so what we found is, hemorrhoids are dilated veins that are around the rectum that cause pain, that cause bleeding. And the traditional treatments were always to address the hemorrhoids directly, to either do banding, where you go in and put rubber bands and then they would die and fall off, or to go in and try to burn the hemorrhoids, or to actually do a hemorrhoidectomy where they go in and surgically remove those hemorrhoids. The problem with those procedures is the banding typically has a high recurrence rate, and the hemorrhoidectomy is a pretty painful procedure with a lot of downtime, as you can imagine, when you're going in and operating on that part of the body. And so what we found is that although the hemorrhoids are venous, they're dilated, they're basically varicose veins in that part of the body, that if we can go down into the artery going to the hemorrhoids, and we can decrease the blood supply and we can decompress those hemorrhoids, then even though the hemorrhoids don't go away completely, they decompress down and the bleeding and the pain gets better. And so that procedure is done right here in the office. It's actually done in what we call our laboratory. You come in the morning, we start an IV, we have an anesthesiologist here to give you some medicine to help you relax. No breathing tube, no ventilator, just sedation. And then we go into the artery in the wrist, and then we put a catheter all the way down into the artery going to that part of the colon. And then we actually put a smaller catheter right out to the hemorrhoids. And then through that catheter we can inject these little particles and put some little small coils that go in there and block the blood supply and decrease the blood supply going to that area. Procedure takes around 30-45 minutes. Once we're finished, everything comes out of the body. We put a wristband on your wrist, we'll roll you back in recovery. As you wake up from anesthesia, something to eat, something to drink, go to the restroom, you go home a couple hours later. The pain is pretty minimal afterwards. Some patients describe a little bit of irritation around the rectal area for a couple days, sometimes kind of an urge to go to the restroom. Typically it's treated just with topical lidocaine cream and resolves on its own within a few days. We see an improvement in the bleeding pretty rapidly within the first couple weeks, but it continues to improve for a few months.